to call this special called meeting at 5 p.m. May you rise for a pledge of allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. May be seated. Go ahead, Mr.
Yes, we made the commissioners, staff. Tonight's meeting, we have one item, which is under the discussion of possible action. We have discussion of possible action to take the recommendation of the record for employee health and monetary project for the club period January 1st, 2025 to December 31st, 2025. We have our agent recognition, Council Valensky, is going to be here to present the plan that they put together. As you know, we went out for bids on the products. They did permitting of these products, and so they're here to give us that recommendation. In front of you, you have the packet for the review as he's going for it. Mr. Valensky.
Yes, good afternoon. My name is Jonathan Sakulinski, your agent of record for the city of San Juan. Thank you for having me, Mr. Mayor, the council, and city manager and administration. And I want to thank your admin and your purchasing department. We worked very quickly to get an RFP together, and it ran very smoothly. So we went out for bids for medical for this year, so for January 1st, 2025. So we were with United Healthcare for 1 year. We did not run very well this year. Unfortunately, we had a lot of high claimants this year and a lot of new high risks that weren't here last year.
How many claims?
So we ran at a 169% loss ratio this year, which means if there's $1 million in premium, we had 1.69 million in claims.
Okay.
So we had run a little bit higher than last year. Last year, I think we were in about the 105, 110 range, and this year we went up.
That's just basically because of one certain or a couple of certain claims that were high.
Yes, and then there's some new high risk. So there is some stuff I want to look at for this coming year to do so we can help lower our RX costs, because the RX cost is what's really driving this program. There's some injections and some specialty drugs that are really driving this cost up. So we're actually working with some different PBM consultants to try to get this down. So right now the city's on a fully insured plan. So we're going to be staying there. The goal, to the next year or two, once we control these RX claims and medical claims, we want to look at pursuing a self-funded plan where we actually get to control our plan design, and then we can actually control our pharmacy costs. Because whenever we're fully insured, we're at the mercy of Blue Cross, United Healthcare, because they own their own PBM. So there's no one really monitoring that, and we're not getting any rebates from their own PBM. It goes right back to Blue Cross, right back to UHC or Aetna. So that's what our long goal here is to maintain and reduce these spike RX claims, and then so we can get that under control. And then the next year or possibly 2 years, move to self-funding, which we have in some other school districts, so we can really reduce the cost of the RX. And then on top of that, moving forward, maybe some of these drugs we can do internationally, if we have it for some of our school districts, where we can get 40 to 60% off these costs and give it to our employees at zero copay. So that's our goal here. But right now, for this 2025, we have to work on stabilizing these costs. And I'm going to be working with Martine, with some other PBM consultants to help lower these RX claims, because these are all new for this year. We didn't see some of these risks. So with that being said, with the loss ratio we did have a 39% renewal from United Healthcare, which is very high. So that's why we took this out for RFP. So we took it out. We did offer UHC to give us a best and final offer. They remained at the same 39%. So we looked at other options. Aetna declined a quote. Cigna did submit a bid. They emailed it, and they also mailed it to the city, but it was 2 days late, so we couldn't accept that bid. But we did have a bid from Texas Health Benefit Pools, which is formerly known as TML. They actually use Blue Cross's Blue Shields network of Texas. So we had a quote from them, we had a quote from Blue Cross, and we had a quote from Healthcare Highways. And we're going to go over all of them. So on your first page, you'll see that. So the city offers 3 plans. We offer a base plan HMO, $4,000 deductible, and then we offer a mid plan, which is a PPO, and then the buy-up is a lower deductible PPO. So on this first plan, you're going to see we were currently paying $498.80. Our renewal was at 39%, which is $693.33. We have 208 employees on the employee only. We have 1 on the employee spouse. We have 8 on the employee children. Of the total of 217 participants, where the bulk of the population for the city employees is on this base plan. This is provided to the employees at no cost. So our quote we got originally from TML, Texas Health Benefit Pool, we had a $715 plan, $715 for the employee only, which was over the renewal. But when we got the BAFO, we gave them a second offer for the best and final offer. They actually came in under what United Healthcare was offering. So far, we are liking Texas Health Benefit Pools. So if you go on to the next page, this is another bid we got matching the base plan. We're going to do the base plan first and then go to the mid and then the buy-up. So on this base plan, we're comparing what we have now currently with UHC. We were at $498.80. We had a 39% renewal at $693. So Healthcare Highways, this is a new carrier. They haven't been in the industry that long. They don't have an actual network. They basically have contracts with different providers and hospitals scattered throughout the valley. So in Hidalgo County, for instance, there's only 20 different PCPs or hospitals actually in Hidalgo County. That is extremely low. Cameron County only has 1 provider in network. They have 5. Willacy has 1, and Starr County has 1. So if we would look at potentially going on this option, even though it's less expensive than what TML or Blue Cross would be, it would be a hindrance on your employees for access to care. So I would not recommend you.
Not even worth looking at.
Not even worth looking at. So yeah, we can just keep moving forward, please. And then this is where we are recommending to go with Blue Cross. So we originally had their first offer was at a 27% renewal at $632. This plan matches apples to apples exactly to the base plan. The one hindrance is that United Healthcare has this great thing for their kids. They have a $0 copay for the primary care physician. They're the only carrier who does that. So Blue Cross is not going to offer a $0 copay for the kids, unfortunately. But they do offer a great PCP copay of $10. Specialist is remaining the same at $60. ER is still remaining the same, $500 plus 20% coinsurance. Urgent care $25. Labs and x-rays, exactly the same. Prescription drug copays is exactly the same. So the first offer they submitted was a 20% increase, 27%. We offered all the carriers to submit a BAFO. They submitted a 24% renewal, but they also submitted on dental, vision, basic life, short-term disability, long-term disability, and voluntary life. So they offered us a 2.5% bundle discount if we went with their products, and you're going to see those in the later slides. And they did offer a pretty competitive package with those products. So when you factor in the 2.5% bundle discount, we're going at, if you follow down the very far right, you go down bundle rates with 2.5% off. We go down to $602.09. But on top of this, we got Blue Cross Blue Shield to offer a one-time transition credit of $35,000 to move the business from United Healthcare to Blue Cross. So whenever we factor in the $35,000 offering, you'll see it's the amount at it's calculated at $590.51. So we got the renewal down to just at 15.5% renewal. Starting on where we started, it was at a 39% renewal. And I know I just threw out a lot. Is there any questions so far? Okay, then we'll keep going. So that was the base plan. Now we're looking at the mid plan. So with the mid plan, also went up 39%. We started out at $562.37. We have 20 employees on this plan, and we have 2 employees with their children on this plan. The renewal's at 39%, and again, Healthcare Highways is what I do not recommend the city going with. This is as far as access to care issues and network. So we'll just move on to the next one.
What hospitals do they have? The Healthcare Highways?
They only have South Texas Health Systems.
Just one?
Yeah.
Oh wow.
yeah, it's not,
Yeah, no.
no.
Okay.
Yeah, the
I
reps,
was just curious.
yeah, the reps, I've met with the reps before. They've flown down if they're out of Austin and they met with me and I was like, how do you want me to sell this? There's only one hospital. I can't, like,
You can't.
no.
Okay. So, I don't know no, that's fine. Go ahead. Go ahead. I'm sorry.
Okay. And then, so the next page, we have a mid-plan structure. And the reason there is not a bid for mid-plans with TML is because they only offer a dual plan option. They can't make 3 plans. So they only offered us a base plan and a buy-up. So there's no mid-option proposal from TML. So on the mid-plan, we were still looking at a 39% renewal. We got it originally at 25% from Blue Cross. After we got the BAFO, got it down to 22. Then after the bundle, we're going to be at 19.5, and then you also have to factor in the $35,000 credit. So more or less, we get back exactly at the 15.5% on the mid plan as well. And this is what we're recommending. They did match the plan design, I believe, identically. So this plan, your employees are going to see no change whatsoever. Quick question? Go on. Okay.
So, on this specialized copay on the mid plan is 40, and I
Yes.
go back on the base.
On the mid plan?
Yeah, and then it's 60 over here on the base plan structure. What?
Are we looking at the mid plan structure?
Yeah,
UHC versus Blue Cross?
correct.
So I see so on the specialist with UHC, I see a 40/80. Is that what you're looking at?
Yeah,
Okay, so I'll explain that. So 40/80. So 40 means if it's a tier 1 contract with that provider, that specialist, you actually only have to pay $40. Everyone else that's not in the tier 1 contract, they have to pay the $80.
that's right.
Yes. And then it was actually a very good offer from Blue Cross. They gave 40 to everybody.
Across the board.
Across the board.
Got it. Okay,
Mhm.
that was my
So that's actually, thank you for saying that, 'cause that was a win for
Yeah,
Blue Cross.
okay. Go ahead, sir.
Next one? Okay. So on the buy-up plan, I mentioned that Texas Health Benefit Pool, they did provide a buy-up plan option. Their offer is better than United Healthcare. They're looking at it. Their plan design is actually a little richer than United Healthcare. When you look at it, they both have a $500 deductible, but the big kicker is the max out of pocket. You're going to see that United Healthcare would currently have a $7,900 max out of pocket. TML, they can't edit their plans. They have basically cookie cutter plan designs, so they can't match plan designs like Blue Cross or the UHC will. So they offer this plan because it's the closest one to it. So apples to apples, TML or Texas Health Benefit Pool, their plan is a better plan design because the max out of pocket is almost cut in half, while the deductible remains the same. But you're going to see on the next page that I would still recommend going with Blue Cross.
Why would you go with Blue Cross over the Texas Health?
Overall, it's a huge savings. I would put Texas Health Benefit Pool in second place. One, because they didn't offer a mid plan, and there's a lot of employees also on the mid plan. I think there was about 30. So that would hinder them. They would have to pay even more just to get on a PPO plan. And overall, the cost savings. So we have, let's say this buyout plan's $807 for Texas Health Benefit Pool. If you go to Blue Cross on the last and 2 more pages, it's at $781, and then also you have to factor in the credit that they're going to give us. So it'll be an additional, 4 or 5% off that too. So that's why I was really recommending Blue Cross. 1, price. 2, they matched everything, your base plan, your mid plan, and your buy-up, and then they gave us a whole package deal.
I'm just looking at the deductibles with Texas Health, and their deductibles in and out of pocket are just way less with Texas Health. And I guess
Yes,
that's a huge complaint that I get from staff is pretty much that they're paying a lot more out of pocket. So a lot of x-rays are no longer covered unless they go to the ER. If they go to a regular doctor's visit, x-rays are no longer covered. So they're
on
only,
the base plan, yeah, it's subject to deductible and co-insurance. The mid is like $40 copay, and then on the buy-up, it's no charge.
yeah. And then well, finish and then, well, I'll ask my question. in a second.
Okay. So we'll go to the next page on the buy-up plan structure with healthcare highways. Once again, this was less expensive than the renewal, but I just don't recommend moving the city to healthcare highways because of the access to the care. And then the last buy-up plan was with Blue Cross. Our renewal was at $860. We have 13 employees on this buy-up plan. Our original renewal was $860. Blue Cross's first offer was at $854.86, so we're coming in under. And their best and final offer is $801.25. With factoring in the bundle discount, we get to $781. And then you also have to consider the one-time transitional credit of the $35,000. So this plan, it matches $500 deductible, 80% co-insurance. Max out of pocket stays the same. Primary copay stays the same, 25. This one they did actually match the specialist 25 and 50 for this is kind of strange. I've never seen Blue Cross do a tier structure with both the specialty. So they're offering a $25 or $50 depending on the classification with the Blue Cross specialist. And then the win here is actually on your emergency room. They actually quoted at a $250 copay plus co-insurance, which previously we had a $500 copay and 20% co-insurance. And then urgent care is $50. It remains the same, and same as well for the labs and x-rays on this plan. It's a no charge for the labs and x-rays. And they match the prescription copays of the tiers of 10, 40, and 80. So that's why we're recommending going with Blue Cross for the medical. Go ahead, Ryan. So the next page, you're going to see the basic life and AD&D benefit. That's accidental death and dismemberment. So the city provides a $25,000 life insurance policy to all of its employees. Currently, we have United Healthcare for all the employees at the rate of 0.21 per thousand and 0.03 per thousand for the accidental death and dismemberment. So we got better quotes from every single carrier that were more competitive than United Healthcare. We're recommending Blue Cross Blue Shield because of that transition credit and the bundle discount and having this more simplistic of one carrier. So this is the exact same coverage. It's lowering our monthly rate from a 0.210 to a 0.196, and they match the AD&D. So roughly, it's about a $1,200 savings per year for the city by going with Blue Cross. Okay. Next, we have the dental. So this plan, they did a 100% match. We shopped it out. We gave we reached out to TML, Blue Cross, and Mutual Omaha. The best bid when you compare all these, next to each other side by side is Mutual of Omaha, at $21.95. They have the same plan design. They have a great network, but once again, we have to consider the transition credit and the bundle discount. So that's why we're recommending Blue Cross. They are coming in less expensive, about 2% less than what we currently have, and we have about, I think, 130 employees that are on this sale plan. They'll see a slight savings. Okay. Next is the vision plan. So this one, again, we're recommending to go with Blue Cross Blue Shield. There was a significant savings for your employees on this one. It's about a 30% savings, but they did not. They were close, but they did not match the plans 100% the same as what we have right now. The big difference is, and actually I want the permission from the council to negotiate with them to get a better vision plan. So if you see, they have a $150 allowance on the frames and contacts currently with United Healthcare. Everyone else was quoting more, or a higher limit, a higher allowance, but Blue Cross quoted a less allowance at $130. So I don't want to decrease the benefit for your employees. I would like to keep it the same or enhance it.
Okay. So as far as the Blue Cross Blue Shield on the vision, you want to hold off on that so you can go back and negotiate.
I would still like to approve all.
Yeah, of course.
But yes, I want to negotiate and get a better vision plan for your employees.
So do we have to bring that back? I mean,
if you give me authority to negotiate, that's fine.
Okay. All right, any questions for Mr. John?
Yes, I guess since you're saying it was the base plan, I guess some of the complaints I was getting, I guess it was with the base plan. If you're saying it's not with the mid or with the buy-up. I guess what they were paying before, what they had the year ago now, they're just that their price out of pocket is a lot more. Like their meds, they're paying double than what they were paying before. X-rays, like I said, but you said depending on the plan. Unless they go to the ER, it's covered. But I know I've had staff call that they need an X-ray on their knee for an injury or whatever, but they won't cover. They have to pay 100% out of pocket. So I guess that's what I was kind of looking at, like how can we help the staff more, even though it's the base plan, how can we help them more? Because, obviously the economy is hurting just in general.
Oh, yeah.
So, and I know we have shop claims and there's other things that have come into play that caused the rise of the fee to go up, but how can we help them more so they don't spend so much out of pocket during these medical situations? So
as of right now for the RX program, I think your employees are going to see they're going to be very happy moving to Blue Cross Blue Shield. Humana's RX was I know we had the year prior. Humana's RX was very generous. They had a very open formulary. So they were seeing a lot, their copays were a lot less. And that's why they've been pushed out of the marketplace as well. So they're no longer.
Because they don't
no longer do commercial or private. Yeah, they only do military contracts or Medicaid. Medicare. But as far as a formulary from moving from a UHC to a Blue Cross, your employees are going to be happy. We typically see that a lot of their copays. Even if you see here that even on the first one, for instance, with their base plan. They have a copay of 10, 40, or 80 depending on the tier of the drug. With Blue Cross, I do like their formulary package because they're not always going to be a $10 copay. It's whatever whenever they get it whenever the manufacturer sends it to the like CVS or Aetna, it's not actually always going to be $10. It's going to be what the actual rebate cost is. So it can get to like $4.72
Right.
or whatever, and it's going to be the lesser of the two. So they're going to like this Blue Cross plan because they are going to pay less than the prescriptions when they go to their copay. And as far as like the labs and X-rays, actually, they do have on the base plan, they do have a $40 copay
Yes.
for the labs and X-rays, and I believe even prior on Humana, I don't think they had that on Humana. I'm not positive. I have to go back and look on it, but I'll double check. But I don't remember if they had copays with Humana or not on the labs and X-rays.
I don't know. If they did, I just know that with the new plan that they got this year, they had to pay more out of pocket. So that, and like I said, I know it's some of the shock claims and, some of the claims that, now they're not covered for obvious reasons, but I just worry about the staff that, they're needing some medical labs or whatever, and they're just not able to afford to do procedures. And that's what worries me for all the staff. Labs, X-rays. So here you have labs and X-rays on the base plan at 40 copay. Blue Cross Blue Shield will be the same. So since we're talking about X-rays, so they can go to their regular doctor. Say they got hurt, not necessarily on the job, but at home they need an X-ray. So with this new plan on Blue Cross, they won't have to go to the ER. They can get the X-ray done with the doctor and not have to pay 100% of the copay.
Correct.
That's correct. Okay.
Yes, and that's one thing we like to push a lot of our, our cities and school districts, even our private companies. If you can stay out of the ER, please do.
Yeah.
Urgent care, you have great copays with the city. You have a $25 copay for urgent care. And we highly recommend, because we can actually recommend, we have some relationships with some urgent cares here in Wesco or nearby that we can actually refer them to. And something I could actually talk to one of the head doctors there, maybe we can start with the city of San Juan doing like a direct provider contract. So if we can refer them over there, maybe we can waive the copay. Normally we do that with self-funded plans, but maybe we can try to put that into our fully insured plan.
That would better help some of the staff, especially if they work sick instead of having. My own doctor, sometimes when you call them, you can be sick today and you still can't get in for a couple of days. So we could work something like that where they can go straight over and address their situation. That would be really helpful and convenient for them.
Yeah, I'll talk to some doctors so they have some urgent cares here and see if we can set something up, like a DPC. We can start negotiations with them.
So basically, because of the bundling and all the packaging, and the other ones they're matching. They're matching what we had previous, right? So,
yeah, Blue Cross pretty much matched everything. They did enhance. You are going to lose that $0 kid copay. Only UHC does that for the PCPs, the primary care physicians. But they did enhance the ER for the buyout plan. They did enhance that.
So their renewal was 30. What?
It was the first renewal was at 39%.
Yeah, so
they did not come down at all.
So that in itself, right there,
Yeah, we in reality we more than cut it in half. We started at 39. We're ending at 15.5.
So like the emergency room, if they do have to go grab it, it's $500 plus 20%.
For the base
On the base
plan.
plan, yes, I'm sorry. On the base plan. Okay.
Yes, that's what we highly. You can't really tell if it's urgent care or in the moment. You don't know. If we can't control it. We highly recommend. And maybe we should do that, in some of your break rooms. We should probably put some places to go. Maybe like in San Juan and Wesco, McAllen. We should probably place like this is a great urgent care to go to, or for labs and X-rays. We recommend going here. So we can start doing that.
Because I know we have is the regional South Texas Health System. We have the urgent care across the expressway, and then on South of the expressway they do all the labs there. So they're kind of like in a little triangular, and then they have the stand-up ER. From there they can transfer to the hospital in a little triangle. So that one's a good one too.
We can reach out to them.
You said we have a lot of increased risks and shock claims. What are we looking at?
So unfortunately, I can't tell you what those conditions are because of PHI and HIPAA. But there is some new risk in this group. So that's why the one way I think we can really start handling this is to go out and look at other, PPM programs or that we can help get these drugs at lower costs. So I've already started working on that as of last night. I was visiting with a PBM gentleman out of New York that has a lot of school districts in the Valley. And I was like, how can I help how can I help with these specialty costs, even though the group's fully insured? And it was like, well, there's some pharmacies out of Houston and Dallas that are in the Blue Cross network or in UHC's network that we can talk to and try to get our drugs from there, and then have them versus getting them here like at CVS or Walgreens. So that by itself will help lower the cost.
Do they provide like the mail, like when they have standard prescriptions, like say
Mail order?
Mail order where they get up to
Yes.
90-day supply? Does Blue Cross offer that for them?
Yes, they do.
Because that comes in at a lower cost as well.
Yes, you do.
When they do the
Once you-
90-day
yes.
supply and they do the mail.
It's like bargain
Right.
shopping there. Costco.
But they don't carry all, they need to check right with the patient to see what medications they're taking.
Well, all the drug lists on the Blue Cross formulary are going to be a 90-day option, regardless. It doesn't matter, so that they can always request a 90-day and do the mail-in.
Just have the doctor on the order, make sure
Yeah.
they put in the 90-day supply on the
Correct.
prescription orders.
I think what the city needs to do is maybe look into getting some kind of discounts as far as at a gym, local gyms to help.
So Blue Cross does offer a wellness program that actually you will get a discount. So I didn't provide that in here, but they offer a lot of perks, and you're going to see that Gold's Gym, Anytime Fitness, Freedom, they have a scale. So like you can get, instead of being $60 a month, you can get like.
Can you email us that information?
Yeah, we can email that.
So that way.
Yeah, they didn't provide it in the RFP, but I can get it from them. They provide it to all key accounts.
Yeah, or email it to Mr. Juan and he
Yeah, the whole wellness package and everything they offer.
yeah, just so that way we can really push that out with our employees and try to get them, moving. You know what I'm saying?
Yeah.
Because at the end of the day, it's going to benefit them. But okay. Is there anything else we need to add?
Steph?
Mayor Remy,
Go ahead, sir.
as far as the dollar amount, what is the difference between the current plan and as far as the total dollar amount increase? Do you have that
So if we go
based on the numbers?
So we basically broke it down by each tier. So like on the very first Blue Cross recommended on the base plan, we were at a 1.346 million this is for 217 employees out of your 252.
Mm-hmm.
So at a 217, you're at a 1.346 million. It was going to go up to 1.87 million. At the end of the day, we got it down. We got a first bid from Blue Cross at 1.7 million, down to 1.66, down to 1.62, and then actually, let me get you the actual numbers. I didn't put it here with the transition credit.
We had more than 217. I thought we had more than 217 employees.
Yeah, you have about 250. So this is just on the base plan.
Got it.
Yeah, on the mid you have 22, and then the buy up you have about another.
Total.
Yes, you have another 13 on the buy up. So we're gonna be in about the high 1.5 million range, like 1.57, somewhere in that range. It's about a 15. The easy math is a 15.5% increase.
For the base plan.
Oh, for all the plans in general, it's around 15.5%.
The average is 30s, in the high 30s, right?
Yeah, the original one was at 39%, and then this what we finally negotiated with went down to 15.5%.
Because you did mention this is the I guess the city's the one that pays the.
Yeah, they pay for the base plan, and then the employees pay the difference for if they want to buy it.
If they want to buy, right. So I guess my question would be, Mr. Juan and Leroy, did we budget accordingly for this type of increase, or did we not?
So what we did was we took a 8% increase forecasted, just to be very conservative, but it's something that
Is it more?
it's gonna be more,
How much more?
What did you project in
8%.
8%? So
And
it's
it's
double.
15, so it's double.
22.
And
How much?
And originally,
Yeah,
you talking about high thirties to?
yeah, it was 39% was the original renewal.
When did you realize that we were gonna get hit with the increase?
Probably about 2-3 weeks ago, whenever they sent it to us, and that's why we contacted the city and said we need to take this out to bid ASAP. And that's why
Does it
we
usually take that long
to do an RFP.
to get an idea of what we're gonna be looking at for the following year?
And
My concern is that we're budgeting in October
Uh-huh.
and we're setting our percentages and then
And then we don't know.
we finalize them. Yeah, and then we can't get hit with this. So that's what I'm trying to figure
Yeah,
out.
so-
Is there a way for us to avoid such a hit?
Like look into in the summer when we're doing our workshops.
So as of right now, as us being a January 1st effective date, the carriers, when you're fully insured, they'll give you a renewal 60 to 75 days out. So that's the fastest we'll see, and it's just depending. 1/1 is the most common renewal date,
Mhm.
so that's why they'll sometimes not give it to us 75 days out. It'll be 60 days out. So once we got first notified, we contacted the city right away. It's like, we need to do something about this, because I know we can't absorb a 39% increase.
And how soon did you contact the city on that? Once you found out?
Probably like the next day after I got the email.
Do you, by any chance, do you have the exact date?
I can find out.
Okay, can you provide that for us?
So the shocks and the shock claims and the risks, I mean, that all plays into part. When did you become aware of those, that was gonna play a huge factor in our?
So the UHC rep, they reached out to me and they said, hey, your renewal's on the way. It's going to be there tomorrow. And they told me, hey, there's new claims in here. There's new high risk. And that's when I found out.
Oh, so when they sent you
They didn't tell me,
before.
no.
So right away you informed the city?
Yes, the next day.
Okay, and this was through email? Or a
Yes.
phone call or?
Well, I called. We have actually, so we have Miss Laura here. She comes to the city every week. So we actually, let the city know. I think it was over the weekend actually, and she always comes on Mondays. So it was the next day. That was on Monday.
All right, any other questions for Mr. Jonathan?
This will be for January 1st effective date?
Correct.
Okay. Will they get the cards in time, or will we have to do what we did last year?
Yes, no, we're gonna get the cards in time. We've actually already worked with your staff to figure out some enrollment dates. I think we're looking at December 5th and 6th. Yeah, December 4th, 5th, and 6th. So we're gonna be done with the enrollment by the 6th. We get everything submitted in our system probably by the 7th, and then we're gonna submit it in. So yes, that is adequate time to get cards by the 1st.
And you're gonna come and do them in person like we did last year?
Yes, we're gonna have four different enrollers here again.
Okay.
Just like last time. And obviously we're gonna provide the booklets again for everybody, English and Spanish.
Do you get numbers on a monthly basis as far as the claims and whatnot?
No, you have to request an HB 2015 form. It's House Bill 2015. So then once you send it to the carrier, Blue Cross, UHC, then they'll send you the claims. We don't get monitoring on the fully insured plan. They don't send us, like if you're self-funded, like a school district,
Right.
they'll send you monthly claims, the ad hoc, the monthly spec ag, and that we'll get every month. But whenever you're fully insured, we don't get it until.
But you could request it.
So you can actually only request it twice a year per law. So we could do it. We could do a mid-year, and that's something we
That's
should look at.
where I was leaving.
We should probably
So you
start.
can project
Yes.
some type of increase so that when we budget, at least we have a projection.
Yes. So I foresee next year. Let's do something in the summer and do the first HB 2015 and give it.
I'd say around June. Around June, that gives a 6-month half year, and then by then they're already working on the budget.
Yes.
All right.
So we can do that.
Give you more stress when you get that 40% increase next year.
45.
45
Yeah.
projection.
But thank you for all the work that you all do.
Thank you.
Any other questions? If not, okay.
Does the staff have any concerns or questions with this year's, with how we worked with the agent of record this year? Smooth? Just because you're here.
Just because I'm here, right?
So that way there's any issues or concerns or something that we can work on to, make it easier for the staff, more accessible. So everything's complete.
There's looking, I know we're having enrollment, for fitness. And since this is effective January 1st, we need to have it, I guess by Friday latest, because we would have to, include it on the payroll, which we get paid on the 13th.
Oh, you're talking about the deduction report? Oh, no, we can do that. So we can have the, if you report this at 6, so we can have that report due by the 10th. Is that okay?
And it would be,
It's a Tuesday, or we can do Monday, so we can have Marco.
Monday would be better.
Well, that's what it
We
takes.
didn't say that.
Yeah, there's a Marco at our office.
Sorry, Marco.
Yeah. Okay. Make a motion to approve as recommended by the agent of record.
It's been a second. All those in favor say aye.
Aye.
Motion carries. Thank you, sir. Appreciate it. Yes, sir. Is there a motion to adjourn?
So moved.
Is there a second? It's been a second. All those in favor say aye.
Aye.
This meeting has been adjourned at 5:47 PM. Thank you.